Skin tags are common, harmless little flaps of skin. They can snag on clothing or jewelry. They can drive me nuts. If I want them gone fast, I see a pro for freezing or snipping. But if I'm exploring gentle, home-based options, here are the most talked about natural approaches, plus must-know safety rules. Quick rule book: I keep the area clean. I patch test anything new. I stop at the first sign of burning. I stop at the first sign of swelling. I stop at the first sign of rash. If a tag is changing color, I call a dermatologist. No DIY. If a tag is bleeding, I call a dermatologist. No DIY. If a tag looks unusual, I call a dermatologist. No DIY. Tea tree oil. I dilute a few drops in a carrier oil like coconut or olive, dab it on with a cotton swab, cover and leave overnight. I repeat daily for 1 to 2 weeks until it dries out. If my skin stings, I pause. Apple cider vinegar. I mix ACV 1:1 with water. I soak a cotton ball. Place it on the tag for 15-30 minutes. Then I rinse and moisturize. I repeat daily for several days. If my skin gets angry, I stop. ACV can be harsh. Banana peel. I cut a small piece. Inner side down on the tag. Tape it and leave overnight. I repeat for 1 to 2 weeks, keeping the area clean. Garlic. I crush a fresh clove to release the juices. Place a tiny piece over the tag and cover overnight. Rinse in the morning. I stop right away if there's burning. Garlic can irritate. Iodine. Using povidone iodine, I apply a small amount with a swab. I cover daily for up to a week. I use sparingly and skip if I have thyroid issues unless a doctor okays it. Duct tape, shock occlusion. I place a small piece over the tag to cut off air and friction. I leave it on for 5 to 7 days, swapping if it loosens. Sometimes the tag shrivels and falls. I keep it clean to avoid infection. Oregano oil. It's potent. So I dilute 1 or 2 drops with a carrier oil. I apply 2 to 3 times daily for 1 to 2 weeks. Patch test is non-negotiable with this one. Important don'ts. I don't cut a tag at home. I don't tie off a tag. I don't rip a tag. Bleeding and infection aren't worth it. I never treat tags on eyelids. I never treat tags on genitals, or anywhere I can't see well. When I call a pro, rapid growth, color change, pain, repeated irritation, bleeding, lots of tags appearing at once, or if I'm unsure it's a skin tag. Bottom line, natural remedies are mostly anecdotal and slow. I go gentle, I stay clean, I listen to my skin, and I involve a healthcare professional when in doubt. Comfortable skin beats risky shortcuts every time.